Hello friends, welcome to my YouTube channel MedPlus. Today we are going to discuss Jiipmer previous staff nurse questions, a quick review. So the first question is appearance of U wave in ECG indicates. Appearance of U wave in an ECG indicates. Options hypercalcemia, hyperkalemia, hypokalemia and hypocalcemia. The answer is hypokalemia. So appearance of U wave, particular U wave in ECG that indicate hypokalemia and U wave. Hypokalemia means what? Potassium level is less in the blood. If potassium level is less in the blood, that shows U wave in ECG. So U wave means hypokalemia. The second question is enlarged ventricles in CT scan indicates. Enlarged ventricles in CT scan indicates. There are four options: hydrocephalus, brain abscess, stroke and brain tumor. The answer is hydrocephalus. So hydrocephalus means what? Abnormal condition in which buildup of fluid in the ventricle. So in brain ventricle, abnormally fluids are collected or fluids are built up. So what will happen if fluids are collected in ventricle or fluids build up in ventricle? Ventricles is a cavities, so that will enlarge or widen. That widens or enlarge means that will reflect in the CT scan as enlarged ventricles. That is why the question came, enlarged ventricles in CT scan indicate which condition? So answer is hydrocephalus. Third question, alternative day high grade fever with rigor indicates. So what is the question? What is the keywords in question? That is alternative day high grade fever with rigor. So there are four options. First one A, pneumonia, B, TB, tuberculosis, C, malaria and D, typhoid. Answer C, malaria. Then fourth question, which of the following condition can cause fever? Which of the following conditions can cause fever? So first one, hypothyroidism, hyperthyroidism and gastritis and all of the above. So answer is hyperthyroidism. So hyperthyroidism can cause increased thyroid hormone. Hyper means increased. Thyroidism means thyroid hormones are increased. Can lead to increased metabolism and thereby increase in body temperature. That is the reason. So hyperthyroidism main characteristic feature is one of the main characteristic feature is fever. Fifth question, which of the following patterns of respiration is seen in patient admitted with injury to medulla oblongata? So for the patient who had injury to medulla oblongata, what type of respiration is seen? That is the keywords. So four options are there as usual. A, Biot's respiration, B, Cheyne-Stokes respiration, C, Kussmaul's respiration, D, apneustic respiration. So the answer is Biot respiration. So injury to medulla oblongata, what respiration? Biot's respiration. Injury to medulla oblongata, that will cause Biot's respiration. Next we will see how it's work. So it is also known as ataxic breathing. It is other name for Biot's respiration is ataxic breathing or other name. The options can change. Ataxic breathing instead of Biot's respiration, sometimes you can see ataxic breathing. That is also seen in medulla oblongata injury. So what is meant by Biot's respiration? It occurs when patients of apnea alternate irregularly with series of breaths of equal depth that terminate abruptly. So in this Biot's respiration, first there will be a period of apnea. Apnea means absence of breath. Then alternate irregularly with series of breath of equal depth that terminate abruptly. So first apnea, Then irregularly series of breath with equal depth that terminates abruptly. So those who are having medulla oblongata injury, the particular type of respiration is Biot's respiration. So next is the sixth question. Consensual response of people indicates. So most of the people are not familiar about this consensual response. First we will see what is consensual response. Consensual response means is any reflex observed on the side of the body when other side is stimulated. I will tell an example. I am putting a light to our right eye, then left people will be constricted. So which part of the body I am giving stimulation? Right part. But the response is seen in the left side. That is this consensual response. So question is consensual response of people indicate damage to oculomotor nerve, damage optic nerve injury, and C is the cerebral aneurysm and D is normal response. Answer is optic nerve injury. So consensual response of people indicate optic nerve. So next is the seventh question. 3% normal saline can be included under the classification of, that is the question. There are four options. First one isotonic solution, second one hypertonic solution, third one hypertonic solution, and fourth one colloid. So the answer is hypertonic solution. Then how I reached to the answer I will tell. First, we have to understand what is the isotonic solution. Isotonic solution means the salt concentration is same as blood. What is the salt concentration in blood? 0.9%. Next, what is mean by hypotonic? Hypo means it's less sugar, less salt content in the blood. Then hypertonic means what? The salt content will be more. So here 3% normal saline. So our baseline is 0.9. So 3% means it is higher side than 0.9. So automatically it will come hypertonic solution. So 3% normal saline can be included under the classification of hypertonic solution. Eighth one, what is shelf life of RBC? What is shelf life of RBC? So answer, sorry, options: A 80 days, B 120 days, C 35 days, and D 15 days. So answer is C 35 days. So what is mean by shelf life? Now we will, some people will get a doubt. What is mean by shelf life? Shelf life means that is when we will collect a blood from an individual and we will store in a refrigerator. So that how many days we can store without injury to RBC. So RBC can store in the refrigerator for 35 days. So that is shelf life. So next is the ninth question. Post-operative hemorrhage within 24 hours of surgery is termed as. Post-operative hemorrhage within 24 hours of surgery is termed as A. Primary hemorrhage, B. Secondary hemorrhage, C. Reactionary hemorrhage, and D. Tertiary hemorrhage. Answer is C. Reactionary hemorrhage. So what is meant by reactionary hemorrhage? Commonly we heard primary hemorrhage and secondary hemorrhage, but reactionary hemorrhage we are not familiar. So we'll see what is that reactionary hemorrhage. It occurs when the patient's blood pressure rises and dislodges the blood clot. So when due to, maybe that is because of fluid overload, so many reasons are there. Because of any of the reason, the main first and foremost reason is the fluid overload. Due to that, patient blood pressure rises and that will cause dislodgement of blood clots, and that will cause hemorrhage. That is called reactionary hemorrhage. And secondary hemorrhage can take place up to 10 days after injury. So according to the time period, primary hemorrhage will occur at the time of injury. At the time of injury, secondary hemorrhage take place up to 10 days after injury, and reactionary hemorrhage will be 24 hours to 48 hours of. So the 10th question is ideal weight gain expected during parenteral nutrition. Parenteral nutrition is the nutritional therapy, that is we are giving the nutritional contents through an IV line. Parenteral route. So answer first one, A option 0.5 kg per week, B 1 kg per week, C 1.5 kg per week, D 2 kg per week. Answer is 0.5 kg per week. So ideal weight gain expected through parenteral nutrition, that is 0.5 kg per week. Thank you. Please subscribe, like and share.